According to the Centers for Disease Control and Prevention, roughly 3.6 million U.S. youth report using e-cigarettes in the past 30 days in a 2020 survey. E-cigarette companies like Juul create flavors like cotton candy and gummy bear, which advertently or inadvertently attract a younger customer base. Welcome everyone to Smoke Break with Public Health 104 Community Health Promotion at San Jose State University. I'm your host, William Pon, along with my colleagues, Marlena Sandoval, Darren Espelita, Natalia Hernandez, Yesenia Garcia, and Nguyen. On today's episode, we will talk about several things, including personal stories from people who use tobacco or nicotine, the facts surrounding this issue, and how to be a support system for those wanting a smoke break for good. Up first today, we've got Marlena Sandoval. Marlena is a senior at San Jose State, majoring in public health and minoring in biological sciences. She currently works as a behavioral therapist with children with autism and plans to pursue a career in radiology. She conducted a few interviews with friends who have started using nicotine or tobacco and their current physical health.
Hi everyone, thank you for joining Secondhand segment on today's podcast. I will be talking with a few acquaintances today. During the interviews, I will be keeping their identities anonymous for privacy reasons. The first interview is going to be with Kelly, who is now 24 years old and is an avid Juul smoker. Kelly was a track and star field throughout high school, and we'll be checking in to see what has and hasn't changed since the beginning of her tobacco usage. The next interview will be with Roxy. She played tennis all 4 years throughout high school. She currently does not take part in any extracurricular or physical activities at her current college. According to Roxy, she hits her vape pen about 30 times a day, so she's also considered an avid smoker just like Kelly. Okay, so first off, how did you start smoking?
How did I start smoking? I feel like it was more of a social thing in high school. I feel like it kind of started off slowly with just weed, and then Juul started becoming really popular, and then that started becoming a thing.
I remember that.
Yeah, so I definitely started, in high school, everyone was doing it, my friends.
Friends all ended up having a Juul, and then since they all had it, I would just hit it as well, and it got me hooked. Yeah.
Have you tried to stop at all?
Yeah, I tried. One time I thought I was having a heart attack. Totally wasn't having a heart attack. I just had a misaligned rib. But it freaked me out so badly that I quit. And then again, my peers around me were still utilizing it. So
I've tried, but I feel like that addiction is always going to be sitting with you, especially since it's nicotine and stuff. I never really understood why people would smoke cigarettes until, it's more tolerable than smoking a cigarette, I would say. And now they have other pens where it's flavored. So I would smoke the flavored ones now.
So did you know that one Juul pod contains 200 puffs? And that is equal to smoking 20 cigarettes. So the math on that means that for every 10 puffs, you're smoking one regular cigarette.
Oh, wow. I mean, I didn't know that. That's really interesting to know. It kind of makes me consider stopping. But I would say I kind of go through at least 2 or 3 Juuls a week. And that's really bad.
How does that make you feel?
it makes me feel horrible. I don't like cigarettes.
So that was 10 puffs, right, is equal to one cigarette. So you said you hit your puff about 30 times a day on a good day, I should say, or a bad day. And that should be equal to about 3 cigarettes a day.
That's crazy. I don't want to think of that.
You don't want to think about it. So do you think after hearing that, maybe you're going to try to do less than 30 a day?
Yeah, definitely. Bring it down to 20, then 10, then 0. You got to slowly ease into it.
My last question for you. When was the last time you ran a mile or did a cardiovascular exercise?
I mean, I still go to the gym. I would say I still try to maintain fitness in my daily routine. I don't think Juul smoking has ever stopped me from doing that. I wouldn't say I would like run a mile like actively still. I'm definitely not as fit as I was in high school regarding that. But I feel like it's still doable for me. Probably won't beat my earlier times of like.
So you definitely feel that
It's slowing me down a little bit.
It's slowing you down.
So my last question for you is, when was the last time you ran a mile or did a cardiovascular exercise?
I couldn't even tell you. I want to say like probably back in high school because that's when I like needed to do it for like tennis.
Right?
Yeah, and then
Okay.
since I don't play, like I don't really play like sports like for a team anymore, so no one's like forcing me to, so I'm not forcing myself, I'd say.
So do you feel that if you were put in a position right now and you had to run a mile or you were asked to do some sort of cardiovascular exercise, do you feel that you smoking all the time would have an effect on you?
Oh yeah, I feel like I wouldn't be able to run a fast mile versus like even run it. Like I might need to take like a lot of breaks if I did try to run it. I don't even know if I would be able to.
Thank you for talking with me and answering my questions.
Yeah, of course. Thank you for having me.
Thank you for answering my questions.
Of course.
Thanks, Marlena, for those interviews. I doubt I can even run a mile, and I don't use nicotine or tobacco. Next up, we've got Darren Espelita. Darren is a senior at San Jose State with a major in public health. He currently works for the College of Sciences and plans to go into nursing in the future. During his interview, he sat down with a very close friend of his and had her explain her experiences with flavored tobacco and flavored nicotine.
Thank you for the introduction, William. As previously mentioned, today we will be listening to an interview I conducted with one of my close friends, Jessica Soriano. Hello, everyone. We are here with Jessica Soriano, who is a political science major studying at UC Riverside. She happens to be one of my close friends, and she'll be able to provide us with an inside look on why she began smoking. What's up, Jessica? How you doing?
I'm doing good. How
It's
about
been a
yourself?
while since I've seen you. I'm doing well, but it's been a while since I've seen you. So, first question I want to ask you is, with quarantine and COVID-19 going around, would you say that smoking or your smoking has increased?
I definitely do think so, just because I am home a lot more. As if like when I'm out in public or out on campus, I do definitely avoid smoking. So yeah.
For sure. Next question is, growing up together from kindergarten until now, we were exposed to so many anti-smoking campaigns from school. So what made you decide to start smoking?
Um, Sad to say it, but I think it was more or less peer pressure. Maybe not direct peer pressure, but like I here in Riverside, at least like a lot of people here do vape, sadly, but it was just always around me. And one day I was kind of like, I want to try it, and like because it is addictive, obviously, I got addicted. So
Yeah, that actually leads into my next question was, do you ever feel like you have a withdrawal towards nicotine? And if so, can you describe your symptoms?
I do get withdrawal. I feel like I just feel like I also don't get those normal symptoms that a lot of other people I know do have when they do try to quit. I more or less just I don't know. I kind of just like really want it. Like I just keep want it. If I try to quit and I don't have it, like I just kind of just really want it. But I don't really get physical symptoms. Maybe I think the only thing is probably like difference in my eating habits. I'll probably eat less or more, honestly. I can't really remember which, but yeah.
Okay, sounds good. Lastly, with the oversaturation of these tobacco products in the market with things like Juuls, Puff bars, and the advertisements we see in billboards on freeways, my question is, do you think that the marketing of flavored tobacco products have played a role in your decision to start smoking? And to continue on that question, do you have a desire to continue smoking in order to try new flavors?
Um, as for the marketing, honestly, it I never really paid attention to it. I never really saw like people promoting it or promoting not to smoke. It was just kind of just like something that was always around me, so I already knew about it. So it wasn't really an influence to me, no. Um, can you repeat the second question? Sorry.
No problem. The second question is, um, did you have a desire to try these new flavors, and did these new flavors entice you to continue smoking?
In the beginning, yes, definitely. I was like, oh, apple, watermelon, or like mango. I did want to try it. However, over time, personally, like the flavor, you just kind of get tired of all the flavors, especially if you've been smoking for a while. You've kind of been through all the flavors. And for me personally, now, even though I do still smoke and I do still like go out and like get new disposable flavored tobacco puffs or like hype bars or whatever they're called or whatever it is. Personally, I hate the flavors now. I will usually stick to just like a menthol flavor just because it's very like kind of neutral. So the fruity flavors I don't really like at all. And I know a lot of other people do feel the same way, a lot of my friends at least.
Okay, for sure. So thank you everyone for listening. Thank you, Jessica, for allowing me to interview you and giving us an inside look on why you started smoking. And it was good talking to you.
Thank you. It was good talking to you.
Thank you for listening to my segment of Smoke Break. If you guys liked today's episode, don't forget to like and comment. I will now be passing it back to William, who will introduce the next segment of our podcast. Thank you. Thank you, Darren. You would think with all the advertisements that you see at the liquor store, at the grocery store, even getting gas, that it would play a part in your friend's decision to pick up nicotine. Coming up next, we've got Natalia Hernandez. Natalia is a third-year student at SJSU studying public health and is a resident advisor for SJSU's housing. She plans to pursue nursing post-graduation just like Darren. In her interview, she sat down with a cousin who uses nicotine products and asked why she uses them and how she got into it.
Hello everyone, my name is Natalia, and as mentioned by Will, I majored in public health here at SJSU. I decided to pursue my major in public health since I plan on creating change in order to protect the health of individuals and communities for the future. So, for today, in this segment, I have a very special guest with me who is here to share their story of how and why they started vaping. The special guest is actually my cousin. We'll call her Jenny for the day. I wanted to invite a close and trustworthy family member to personally hear them out and understand how it all started with the vaping. I've never vaped, and honestly, I don't plan on trying it anytime soon. It literally doesn't even attract me. But I wanted to share with you all that even though some of us, like me, haven't tried it, we've connected to someone who has. Flavored vapings are literally everywhere, and unfortunately they have become very popular amongst the younger population, which is dangerous since it can be deadly. I'm also here to overall hear my cousin out to see why she even started vaping and if she's even been influenced. So Jenny, how are we doing today?
I'm doing good. How are you?
I'm good. I'm kind of tired, but we're here.
Oh, man, I feel it.
Didn't you just get off work?
Yeah, I just got off work not so long ago.
Okay, but now you're relaxing, so it's all good.
Right?
Okay, so now I'm gonna go into the meat and bones of the vaping questions.
Okay.
So the first question I'm gonna ask you is, how old were you when you started vaping?
I was, 20. I currently still am 20 years old. I started when I was 20.
Okay, so you just started last year, or?
Yeah, I started, to be specific, in November.
Okay, sure. And how were you introduced to vaping? Was there anyone who introduced you to vaping, or, yeah?
Yeah, at the time, my significant other had introduced me to vaping. That's like when it all started.
Mm-hmm. And did he force it on you to try, or it was all consensual and you were willing to try yourself?
No, yeah, it was all consensual. He brought it up. He had it with him, and I was like, you know what? Why not give it a try? See what the hype is about.
Mm-hmm. So you just wanted to try to see what it was, because everybody would do it. Did you know people that would do it before? Was there any other people you know besides him that would vape?
Not necessarily vape, but I do surround myself with other people that are smokers.
Okay, but they didn't influence you. It was your significant other who actually started.
Yeah.
Okay.
And I know there are the flavored vapings. So, I mean, what flavors do you usually get? Which one did you first try? And which ones do you like?
The first one I tried, I think, was pomegranate, I believe it was. It was kind of like a burgundy-ish one. I would say my favorite flavor, currently the flavor I have is a watermelon one.
Okay. And how many flavors are there actually? Because I honestly don't even know.
Honestly, many flavors. There's peach, there's berries, there's strawberry, kiwi. Like, honestly, there's any flavor you can think of.
And like, does it actually like taste like the actual flavor it says it is?
Some of them do. Some of them taste a little funky. Not gonna lie.
Like nasty or like good?
Yeah, kind of like, yeah. Some taste nasty. Some don't taste that good.
And you still do it even though it's kind of nasty.
No, like those I kind of just like throw out.
Oh, okay. And you keep the ones you actually like the watermelon one?
Yeah.
And does vaping help you with anything? I don't know. Some people might use it for anxiety and stuff.
Yeah, usually I guess I would say it's a stress reliever. I do it whenever I'm stressed or just like when, I don't know, yeah, just mainly when I'm stressed, honestly.
Okay. And so you do when you're stressed. And actually, fun fact, I don't know if you were aware, but according to Flavors Hug Kids, in the nicotine inside the vape, obviously it's poison, as I feel like everyone knows, and the nicotine can actually increase anxiety, mood swings, and irritability at a developmental time when life is hard enough. So it kind of worsens your moods already. Did you know that?
No, I didn't know that.
And have you ever thought that maybe the reason sometimes you're anxious or stressed is because of the nicotine that you're taking in?
Yeah, I never really thought of it that way.
Maybe before you tried it, were you already stressed enough, or after you tried it, you became more stressed?
No, I was already stressed enough because of work. So, I mean, I guess it's all in your head that it helps, I guess you could say.
Mm-hmm.
That, like, supposedly, it helps you relieve your stress or whatever. But honestly, it's just all in our head.
Yeah, so just be careful next time you take a next puff if it's going to help you.
Yeah.
And then, do your parents know you vape, or who knows that you vape? Any other friends or family members?
Yeah, friends and family know I do. My parents don't.
Like I do. I know.
Yeah. Yeah.
And then, have you yourself introduced vaping to someone else, and have they started it?
I mean, people see me do it. Sometimes they ask to try it. I don't usually offer. I try not to, I guess. But sometimes, it's just there, and I'm just like, oh, no, you want to try it. Like, I know, I see them staring, and they don't want to ask. Mm-hmm. So that's when I ask. But people that I surround myself with, no, they don't use puff bars. They've just, like, tried it because of me, but, like, they haven't bought one for themselves.
Oh, so it was just, like, a one-time thing for them?
Yeah.
Okay. Mm-hmm. And then my last question for you to end this is, have you ever considered giving up on vaping?
Yes, I have considered it. I mean, it's not good for us. It's not good in general. All those chemicals, the nicotine, with time, it affects your lungs. I have considered giving up. I hope to soon, honestly.
Okay. And what's one thing that would motivate you, or what's that one thing you need to actually give it up? What would actually help you?
That's a really good question. I feel like, honestly, I used to go to the gym a lot. Mm-hmm. And recently I haven't really been into it as much. I feel like if I get myself back to the gym, I'm going to realize how bad it's affecting my lungs, how bad I'm going to be out of breath. Mm-hmm. Because within time, it just affects your lungs. Excuse me. Mm-hmm. And I feel like I'll realize it once I get to the gym, actually start working out, doing my workouts, and realize I'm, like, really out of breath so soon,
Mm-hmm. So, like, do you think instead of vaping, like, working out would kind of help you, and it would motivate you to stop?
Yeah.
Okay, for sure. And if you need other motivators, just know that me and your other cousins, who would help you out.
Thank you.
Well, thank you for doing this. Thank you for your time. I appreciate it. And I hope you have a great rest of your day.
Thank you, too.
Bye.
Thank you, Natalia. It always hits harder when it comes to family, so thank you to you and your cousin for sharing. Given these testimonies, what are the statistics and facts behind the dangers of smoking? For that, I'll pass it off to Nguyen, who is a third-year public health major, who is passionate about public health promotion and direct patient care. She hopes to become a physician's assistant in the future.
Thank you, William, for the introduction. So in this section, I'll be covering the facts surrounding tobacco use, its effects on our overall health, and I'll also go over some strategies to reduce tobacco usage. Before you doubt, the information and resources in these sections are gathered from one main, which also is reliable source, the CDC, which stands for Center for Disease Control and Prevention. Before diving into some serious facts about tobacco, I have a quick question for all of you. How many youth do you think try their first cigarette each day? Would it be around 100, 1,000, million, or even trillion? If you are thinking approximately 1,000, that would be correct. Each day, about 1,600 youth try their first cigarette. So the second fact would be smoking leads to disease and disability and harms nearly every organ of the body. Not just any organ, but every organ could be affected by tobacco usage. The third fact would be cigarette smoking remains the leading cause of preventable disease, disability, and death in the United States. So if we could reduce the tobacco usage, we could reduce the diseases that cause death in the United States. Fourth fact would be the tobacco industry spends billions of dollars each year on marketing cigarettes. And that is a huge amount of money dedicating to the usage that could potentially lead to diseases and causes death in the United States. So we should contemplating on where we should delegate our budgets. In this section, I'll cover strategies on how to reduce tobacco use. Another questions for all. What are some strategies you could think of that help in reducing tobacco use overall? There are multiple ways, and I mean multiple countless ways on how to reduce tobacco use. So I believe that whatever you thought of would be correct. So the 4 strategies essential to continue reducing tobacco use overall would be 1. Implement smoke-free laws. 2. Run mass media campaigns. 3. Raise tobacco prices. 4. Make quit help access easy. Out of the 4 strategies, the one stood out to me the most would be number 4, make quit help easy to access. The more easy it is for people to seek these resources, would be easier for them to aid them into the process of quitting smoking and tobacco use. The last section I'll be covering is the negative effects of tobacco usage on our health. That would include physical or mental health. Everyone knows that tobacco use has a negative impact on our health, but how much do we know the impact of tobacco has on us? I hope that one of the 4 following reasons will convince you to stop using tobacco. 1. Smoking harms nearly every organ of the body and affects a person's overall health. 2. Smoking can make it harder for a woman to become pregnant. It can also affect your baby's health before and after birth. Whereas for men, smoking can also affect men's sperm, which reduces fertility and also increase risks for birth defects and miscarriage. 3. Smoking is a cause of type 2 diabetes and can make it harder to control. The risk of developing diabetes is 30 to 40% higher for active smokers compared to non-smokers. Lastly, number 4, smoking causes general adverse effects on the body, including inflammation and decreased immune functions. Out of the 4 negative impacts on our health, the one stood out to me the most would be the last one, where smoking causes adverse effects on the body, which is decreasing immune functions, especially when we are currently dealing with COVID disease outbreak. Our immune system play a huge effect on how to help us stay alive. So that is all the facts and strategies I've covered. I hope that one of these reasons or one of these strategies could help you in aiding your process of reducing tobacco use.
Wow, thank you, Mai, for giving us those facts and statistics. It's actually quite scary what these products will end up doing to you. Last but not least, we have Yesenia Garcia, who is a junior at SJSU majoring in public health. She is also one of the peer mentor leads at Peer Connections, which is a service offered to SJSU students. Yesenia will be giving us tips on how to support those taking the big leap to quit smoking for good.
Thanks, Will. As mentioned by Will, I will be talking about how someone who may not be personally addicted to tobacco products can best support someone who is. I will also be sharing with you all my experience of being someone's support system and some tips I found when researching and looking at websites such as the American Cancer Society and smokefree.gov. As college students, we exist in an environment that has normalized many unhealthy actions and habits and deemed them as part of the college experience. As a junior in college, when I look back at the first time I saw my peers partake in these habits, I remember feeling really confused and nervous and having so many questions. And I still remember the first time I saw one of my very first college friends take a drag from a vape pen. I sat across from her and was completely stunned and full of questions and obviously a lot of curiosity as well. Little did I know that oblivious, freshly turned 18-year-old me would later become a piece of her support system when she decided to break up with nicotine and tobacco. As someone who came from a very, very, very sheltered life and had no prior relationship with nicotine, tobacco, or even addiction really, I had to figure out in real time how I could best support my friend through her decision to break up. I did things such as identifying myself to her as someone that she could be around and know that she wouldn't be exposed to triggers such as smoke, easy access to nicotine and tobacco products, and bringing her around people who were partaking in smoking. I also made sure to check in on her with weekly check-ins about her health and her overall emotional health as well. And I also made sure to ask her questions about things that weren't just pertaining towards her addiction with tobacco and nicotine. Ultimately, I respected her decision and her journey, and I made it a point to support her free of judgment. Although I tried my best to support her, I had no prior knowledge on what someone who had become reliant or addicted to tobacco experienced or felt. It wasn't until I took a look at websites such as the American Cancer Society and smokefree.gov where I was able to read more about the effects of tobacco usage and how people like me could help people like her through their journey. Now I'm going to share with you all some tips and things that I read on the smokefree.gov website and the American Cancer Society website as well. The first thing is respecting your friend's decision to quit. Also, offering your support to your friend while making it clear that it's okay for them to come see you when they need support or encouragement. One that really is super important is listening to them. Something that I read from the smokefree.gov website that really stood out to me was the quote, "Quitting smoking is about them, not you." This is really important to remember because this decision to quit is a decision that they make for themselves. Their experience and their journey is theirs. It is our job as their support system to support them in reaching their goal. Also, checking in, not only about their decision to quit, but their overall health and wellness. Dependencies and addictions to tobacco and nicotine products can affect so many different aspects of their lives. Asking questions such as, have you smoked, are really not helpful. Instead, asking questions about how they're coping, what has been working, what isn't working, and what we can do to help them are better alternatives.
Thanks, Yesenia. That was an amazing story and amazing tips on how to become a support system for those around you. Nothing makes you want to advocate more than when it hits home or hits very close to home. Well, that is it for this episode of Smoke Break, everyone. Thank you all for listening. On behalf of Group 15, we would like to give a special thank you to Pauline Vo Griffin for being our agency representative, Fernando Perez for teaching